is the most common hormonal disorder among women of reproductive age. Yet with many people, both patients and healthcare providers alike are either unfamiliar with or confused by PCOS. Well, this morning we are joined by Hilary Wright, Director of Nutritional Counseling at the Delaware Center for Mind-Body Health at Boston IVF. And she's also a nutritionist at the Dana-Farber Cancer Institute in Boston and author of the new book, The PCOS Diet Plan, which you were good enough to send a copy over to about. And I was able to read this over the weekend. What
Terrific.
I noticed, it is a really simple plan for women who have PCOS. For people who don't know, what is PCOS?
PCOS stands for polycystic ovary syndrome, which we now realize to be the most common hormonal disorder of women of reproductive age. And not only does it have short-term health consequences in that it can affect your fertility, but long-term it's a major risk factor for the development of diabetes, heart disease, and endometrial cancer.
And it can really disrupt, any future reproductive plans that a woman might have.
Oh, absolutely. What we now realize is that what drives polycystic ovary syndrome is a condition called insulin resistance, which is the same thing that causes type 2 diabetes, which we know is exploding in our population. This hormone insulin has an ability to get in the way of the hormonal balance we need to produce eggs that are ripe and ready for fertilization. So PCOS is actually the primary cause of infertility in women.
Now, a lot of women who suffer from PCOS are overweight and also suffer from, like you were saying, being pre-diabetic or having diabetes. Do you find that a lot of women don't realize what they're suffering from when they have PCOS?
Oh, absolutely.
Yeah.
What the main driving force behind the book was to try to demystify this condition that is really confusing. Hormonal problems are confusing, and this one has very far-reaching effects. So 60 to 80% of these women are overweight or obese, and 40% of them will be diabetic or pre-diabetic by the age of 40. But the good news is we know that the same diet and lifestyle factors that you'll use to lose weight, reduce your risk of diabetes, control your risk of heart disease, will help to manage the underlying PCOS. My hope with the book is to try to get people to learn how to manage it when they're maybe younger and not trying to have a baby, because then the fire is hot at that point. They need to learn to manage the condition while they're trying to get pregnant.
And they are common sense ideas. What are some of the things that you recommend to women who are suffering from PCOS in terms of a diet plan?
Women with PCOS are very vulnerable to following low carbohydrate diets, which were so popular in the past. And the carbohydrate piece is important to follow because PCOS is driven by insulin resistance, and the presence of insulin is driven by carbohydrate intake. So when you eat carbohydrates, sugars show up in your blood, and then insulin rushes in to move the sugar out of your blood and into your cells. So modest amounts of carbohydrates are important, of the best quality, unrefined carbohydrates, whole fruit instead of juice, and trying to spread them out over the day so that when they are eating their carbohydrates, they'll have a modest amount of insulin circulating instead of eating a large amount of carbohydrate at once and then commanding a lot of insulin.
I think you and I were just talking off the air about how drug companies have moved to this direct-to-consumer marketing where they're saying, here's the drug that you need, go ask your doctor about it. Do you find that women who suffer from PCOS are looking for a pill or a prescription or something from their doctor and don't realize how much nutrition has to do with their condition?
I think that that's frequently the case, particularly if they've been put on a medication called metformin, which is commonly used in PCOS. Metformin is an insulin sensitizer, but it will only help you so much. You really need to learn how to manage your diet, exercise, which also helps us use this hormone insulin. So it's really a Band-Aid approach. The metformin will only get you so far without the diet and lifestyle changes.
Is there a point, though, when a woman has, followed the diet and lifestyle changes and hasn't seen a very big difference? Is there ever a point where a woman should go to their doctor and say, I think another step needs to be taken, or are you confident that good nutrition is the foundation for curing this?
No, I think, particularly if someone is doing everything they can with the diet and lifestyle piece, and particularly if their periods are not coming on a regular basis and they want to get pregnant, at that point they should really have some serious conversations with their OBGYN or maybe a reproductive endocrinologist who can help them tease through their particular clinical picture and say, in addition to the diet and lifestyle, maybe for this period of time, it may be beneficial to take some metformin or some other fertility-related medication to help them meet their goal of having a baby.
Hilary Wright is the author. The PCOS Diet Plan is the book, and for more information or to reach Hilary, all you have to do is go to PCOSdiet.com.